Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary Leblanc. In this inaugural episode of the podcast, we explored the impact that the COVID-19 pandemic has had on some of the country's most vulnerable individuals and groups, and how community health centres have stepped up in response. I visit with the staff of the Alex Community Health Centre in Calgary to learn how their community health centre has adapted to meet the care and support needs of some of the city's most impacted residents. Since 1973, the Alex Community Health Centre has served Calgary residents with complex health needs, often the result of issues such as poverty, trauma, homelessness, social isolation, addictions, and other challenges. It's difficult to be healthy if you're hungry, isolated, or experiencing mental health challenges, let alone struggling to access appropriate services. And that's where the Alex CHC comes in, providing access to the integrated community health center model of care and support, addressing the medical and social needs of individuals they serve. Whole health is the goal. I am here today with Cheryl San Juan, the Director of Primary Healthcare. Hi, Cheryl.
Hi, Hilary. Thanks for having me today. I feel so honored to be here.
I'm so excited to speak with you. So excited to start the podcast with the Alex. What you've done is incredible. You have a report already basically listing all the amazing work on your website, which I was able to peruse and was helped inform my questions on why you guys did such a great job throughout the pandemic. I do want to start, though, with getting you to tell me a bit about the Alex Community Health Centre and some of the main aspects of your organization and the services that you guys provide.
Thanks so much, Hilary. Yeah, like you said, so the Alex, we are a community health center. We have been operating as a nonprofit organization with really deep connections to the community for the last nearly 50 years. I am an RN by background. When I was a nursing student and I had first heard about the Alex, I developed an extremely big organizational crush on the Alex because I really believed in their mandate and loved the populations that they served. And so I feel super grateful to be part of this CHC. One of the things we recognize is that navigating a very complex healthcare system is really challenging for those individuals who need it the most, which is why we try to offer extensive scope of services under one roof. So we do have a community health center, which includes like a family care clinic, and it serves like all ages family care clinic. We have a youth health center with the medical component and social component, as well as, we have a gender affirming clinic, a pre and postnatal clinic. We have a rapid access addictions medicine clinic. We have 4 housing programs. And we also recognize the need for us to be where our populations live. And so we have like our community food center and our seniors health center nestled right in the heart of their communities. And we also have a mobile fleet. So we have a community health bus, a youth health bus, and a dental health bus that travel to all areas of our city to reach those underserved populations. One of the pillars of the CHC model is that team-based interprofessional care. And I'm so grateful that we have that here. So we have a full complement of like physicians, nurse practitioners, nurses, social workers, mental health clinicians, client resource specialists, justice navigators, pre-employment specialists, like really just, again, going back to that, the goal of whole health. I love that we have a full multidisciplinary team. What else can I say? Hilary, you did mention the population that we serve, and it really is that population that has those complex needs, and it is a result of, trauma or poverty or being homeless or at risk for homelessness, and, either social isolation or dealing with addictions and mental health issues. So that is our client population that we aim to serve.
I absolutely love it. And I think people will slowly get to know me through this podcast as well. But I've always navigated under the belief that it takes a village. And so what I love about community health centers is it's really people all coming together to raise up and support people who just have basic needs, who just have a harder time. I think, through life, you're just dealt the cards that you're dealt. And I really love that people always seem to come together to help people. And like the CHC model is just a great representation of that. So unfortunately, we do have to turn to the pandemic, which is all everybody is talking about, but you guys seem to handle it quite well. So at the beginning of the pandemic, what was your initial course of action to keep like all of those clients that you just listed safe and to ensure that they still had access to the care and the support that you guys provide?
Yeah, you're taking me back to the beginning of the pandemic. And I jokingly say I repress a lot of that because it was a lot of anxiety, a lot of unknowns. It's like the whole world was going through the same thing. But
yes.
I'm really quite proud of our CHC. We had never once closed our doors in this pandemic, even with all of those unknowns. Mm-hmm. At the start of the pandemic, I remember facilitating many conversations with our physician and medical leads, and we had philosophical discussions about what our role is in community and in primary care. And what we decided is that we do need to offer those essential services so that we're keeping clients well in the community and not inundating the acute care system. We needed to keep the emergency systems clear. We needed to keep the ICU bed, right? Like all of that needed to be, so what was our role? Our role was to help them manage their chronic health conditions, yes, and any acute conditions in the community as much as we could. So to be able to, continue to provide safe client care right at that very beginning, we had to convert to virtual care. We didn't have our video platforms up right away. That took us a while to figure out, but we did convert a lot to phone appointments. And that was really well received by our clients too, because a lot of our clients use public transit, yes, to get to places. And so again, during that really scary initial period where the protocols weren't really fleshed out, and so it was scary for people to leave their homes. And so to be able to provide healthcare services over the phone was such a huge win for us.
Of course, I can imagine, especially, for people who are not, have accessibility issues. Like I think that would have been something that would have been really crucial. And, you don't want to inundate the emergency rooms. Like you're saying, you want to have that relief, but at the same time, gender affirming care is important to a lot of people. The services that you provide are still, they're a different level of essential. And so you can't take that away from people. It's their basic human rights, right? So yeah. I think that's yes. very crucial. So as you continue to work through that unknown territory, how did you end up adapting your original CHC model to accommodate all of those clients?
So one of the biggest challenges was our drop-in spaces. Mm-hmm. So a big component of our CHC model is having spaces where we can really invite our community members in and prevent that social isolation and make connections to other community members. And during the start of the pandemic, we had to close all of our social drop-in spaces. And instead, so we pivoted to do more intentional outreach. For example, our mobile fleet, so our mm-hmm. youth health bus, our community, and our dental health bus, we grounded that for the first 6 months. It was just a scary time. We jokingly said it was a cruise ship on wheels. And so we actually had all of the healthcare teams that were working on our mobile fleet pivot and work actually either remotely or within our clinic space to do outreach phone calls for those clients that were accessing our mobile fleet. All of our social workers and case managers that were, managing those drop-in spaces, mm-hmm. they actually joined forces. And we created what we called a social dispatch team. So again, they did more intentional outreach. With the drop-in model, yes. It used to be just this walk-in model. Mm-hmm. We also pivoted that to be a same-day booked access. So clients could still get care for their episodic acute needs, but they couldn't just walk into our clinic. We really encourage our clients to call that day, call that morning, see if we had spots. And that was really from that safety perspective of trying to limit people on site. We also extended our hours. So, offering like evenings and weekends to support this, we call it the COVID-19 primary care pathway. And so any of our clients that were COVID positive, we had nurses and physicians call them every single day in a 2-week period to monitor their symptoms and to provide that education. And so we would do those phone calls even on the weekend. And we also had some physicians in some of our housing programs be on call for 24/7. So that was another new thing that we had to do with our CHC model just to adapt, right? And really do a good pandemic response. So
I'm blown away. Not only like I really enjoyed what you were saying about like pivoting and actually like recreating a whole new team, but then also just that amount of extra care to call in, check in on in evenings and weekends and make sure that these people are okay. I know unfortunately quite a few people who ended up being COVID positive, and there's the anxiety around that and the pressure and the stress and then the isolation and figuring out how to get food, how to care for yourself when you're literally alone and separated from society, on top of already talking about a group of people that feels othered and separated from society. Like the layers there, that not me getting emotional, but that work is just so crucial and so important. And this segues into a group of people that mean a lot to me. I was telling you before we started that my mother is actually 70 years old, and I know that you guys provide a lot of specific care to seniors. And as one of the most vulnerable and at-risk groups throughout the pandemic, how are you still able to maintain service for seniors and to make sure that they didn't feel, like further isolated, but also keeping in mind how at risk they are?
Yes. Yeah. So we're fortunate enough to have a seniors health center, and that clinic serves seniors aged 55 and older. And the reason why it's 55 is because our client population is older than their chronological age. And that's due to all the physical stress from, living in poverty or being homeless or dealing with addictions and having mental health challenges. So our seniors health clinic is actually quite fortunate that they are located in close proximity to affordable seniors housing. So our seniors health center is actually on the main floor of this high-rise affordable seniors clinic. So a lot of our clients will come down in their pajamas. It's so cute.
Good for them. Good for them.
Yeah, it's so amazing. So, we already had that, again, the CHC model, because we already had that like trusting relationship with our clients that, and because we have a chart in our electronic medical record for all the clients that we serve, that we are able to pull a panel list of all of our clients that we serve, and our nurses would do outreach. But to your question of how did we pivot to support our seniors, we did a lot. So we did create like a transporting clients protocol. So before the pandemic, our nurses or social worker would help transport clients to important appointments. With COVID, that was a really scary thing. It took us a couple months to be able to land on a protocol that we felt, could be safe for both the clients and our staff. But we recognize the importance of being able to transport our clients. So that was one thing. We also, again, that COVID primary care pathway. So, our doctors and nurses calling any seniors that had tested positive for COVID to call them every single day for the 2 weeks. And then the advanced care planning. I thought this was really beautiful that the seniors team did this. So advanced care planning, having those really important discussions with seniors about who they want to designate as their power of attorney, or who is going to make decisions about their health treatment if they're not able to, right? And so it's really important for seniors to have a really active and current advanced care plan. Those are typically quite lengthy appointments. They're important conversations. You typically want to have them in person. We had to pivot that during COVID. And so because it's such a long process to do, we had the nurses completing some portion of it, the physicians completing another portion, and all delivered safely over the phone. So I thought that was a really beautiful thing that we were able to maintain doing even during a time of, mandated social distancing and stay at home. Yeah.
That is incredible. As someone who, because of the age of my mother, had to do the power of attorney thing completely alone at the age of 22, yes. If I could have had a group of people help me and my mom make those decisions, I can't imagine how much more difficult it is during a pandemic, but it's so hard. A lot of seniors I think we're all like this, but aging is not something we really believe is going to happen. And then all of a sudden it's happened. And the next thing you know, something like a pandemic can come along and really impact your way of life. And so it's so important to have those very difficult conversations of power of attorneys, of beneficiaries, of even I remember the conversation about DNRs with my mom and thinking this feels so far away, but it very well might not be. And something like a pandemic can make that creep up so much faster. And it's really amazing how that CHCs, and this model allows people to, you already have their information, you have their charts, you're able to see what other services you can provide these people because you already know them and you already have this rapport because you're already working with them in so many other different ways. It's like you said, it is completely like beautiful and such a great avenue. Yeah. And on the other side of the coin, the people that your younger services. So for the youth services at the Alex, what ways did you pivot those roles when it came to helping them during these difficult times?
Yeah, so just a quick background on our youth health center. We serve the youth ages 12 to 24. Again, similar description of the client population of who we're serving. So yeah, having that gender affirming clinic, doing a lot of STI testing is very important. We have really strong mental health supports and a really great social drop-in space. Again, so pre-pandemic, we had this beautiful youth drop-in space where, there were computer stations, or there was a kitchen where the youth could come and make their own meal, or there was a lot of crafts and music, and we could see up to 70 kids in a day just coming in through our drop-in space. And so I think that was our biggest and most heartbreaking challenge during the pandemic, is because we worried, where are kids going if they're not coming to us? And so we really tried our best to reopen that space. We invited the public health inspector to come look and see what can we offer safely in this space so that we can still stay connected to youth. So some of the things that we had to do, we did offer virtual mental health appointments, and so they were video. We maintained a really strong presence on social media, because that's the best way to connect with our youth, through Facebook and Instagram, and I actually don't know if they ever made it on TikTok. I know they were talking about that, but
I'm pushing for a community health center TikTok. Don't worry about it.
Yeah, we're like, that is the best platform for youth. I have 2 daughters; they're both on TikTok. That's not my platform for sure, but like, it is for the youth, right? So
it is, yes.
Yeah. So yeah, maintaining a strong presence so that we could say, hey, we're doing same day booked walk-in appointments. So maybe we don't have a drop-in space right now, but you can still book an appointment. We still had a really strong pre and postnatal program. So, supporting the young mothers, and then offering like financial literacy programming virtually. It's a beautiful response. Once we were able to open up our drop-in space again, we had limited drop-in hours, but it was still better than nothing, right? So
of course,
that's some of the things that we did. And then the youth health bus that we had to ground for the first while, again, we pivoted those teams. And so those teams were redeployed to work in the clinic or virtually, and then to do some outreach care.
Of course, I was definitely thinking about, when I was a kid, like what losing that connection, that's so aspect of social would have been like. And it sounds like you guys really tried to do the most that you could to make it accessible for them and try to figure out how to still reach out to them and connect to them. Yeah. I really think that, throughout this conversation, we have sort of underlined like why community health centers are so important, but what do you think your experience throughout all of this says about the ability of community health centers to adapt to emerging social and public health issues, and the importance of community health centers, which I do think for the last, I don't know, 10 to 15 minutes, you have outlined that beautifully. But if there's any more you want to say on how important that model is.
Yeah, our experience here for sure at the Alex, I really feel throughout this pandemic, it's really illuminated how integral CHCs are to the health and social services. I think the biggest part is being able to leverage off those existing therapeutic and trusting relationships that we had with our community members already. I think they get lost in the shuffle when they're only accessing acute care. You don't develop the same sort of relationship that you can at a community health center. So that I think is the biggest advantage of CHCs. The CHC model, I know I've said this already, it's such a beautiful model, that the team-based interprofessional care, focusing on those social determinants of health, because that really is looking at the whole health of the person, and having those integrated health, social services has been so important. And so for our experience in this pandemic, we really leveraged off each other's expertise, like the medical teams with the social teams, the mental health teams. We have some programs in our CHC that didn't have medical supports before the pandemic. So we have like some housing programs or our community food center. And so again, because we are one integrated CHC, we're able to pull off the expertise from the medical teams and provide support for our community food center and the housing programs, et cetera. So I really do believe in that, the community health center model for us, because we knew our clients so intimately before the pandemic and we knew their unique needs, we were able to anticipate the barriers that they may face when the pandemic hit, right? And so things like mandatory masking, we had many conversations about, supporting our clients to understand the importance of masking. Navigating the transit system during the pandemic was also a big challenge for our clients. Virtual care. When we were first talking about virtual care and we were exploring different video platforms, we were wondering, well, how will our clients connect with us if they don't have a smartphone or access to Wi-Fi or all those other things? And so, we were able to anticipate the barriers and sort of proactively kind of come up with some solutions. So that is all because we already had that existing relationship. I think that is the biggest thing. If I can say anything about the CHC model, it's that existing, trusting therapeutic relationship that we can develop with our community members. You can't do that in the greater healthcare system. They get lost in the shuffle. The CHC model also really perfect for the vaccine campaign that we launched. We were able to offer a vaccine clinic here on site to serve our existing population, but we also supported a vaccine campaign to do outreach sites to the shelters and other vulnerable populations. And so again, it was leveraging off those existing trusting relationships that we had with Alex clients, who many of them told us they would not get the vaccine. They would not go to, a super site to get their vaccine, which was run by the greater healthcare system, that they only trusted Alex doctors and nurses to give them the vaccine. So again, it's that CHC model that really supported that, the building of those trusting relationships that made the vaccine campaign, I feel, successful.
Of course. And I think as someone who was, I came from a place of being mainly treated through the regular healthcare system and who's now been opened up and seeing the community health center model. And like I said, not only is it sort of a community work and it takes a village to raise everybody, but it's you are already aware of the privilege everyone else gets to have by not having these intersectionalities or being a marginalized group or being othered. And so for the regular person who can, have a car, have transit, has Wi-Fi, has disposable money, that they don't have to already be worrying about these curveballs that life brings you. A community health center already sees all of the curveballs that life brings on a daily basis to the impoverished people, to queer people, to Black people, to anyone and everyone. So adding COVID-19, while it was disheartening and such a problem for so many people, in a way, it was just another layer of complexity to these people's already complex lives. And it's almost like being a community health center, you're already dealing with so many hardships for these people, like in a way, not it to be like, well, bring it on. Like we already help these people who are struggling. And so we're ready for another struggle. We're going to try to help make these people's lives as easy as possible because they deserve it. And that is what this model stands for and what we're here for. That's how I see it. And I think it's a really beautiful thing.
Yes, agreed.
So for the Alex, you guys are the alex.ca and the Alex CHC on Instagram and Twitter. So, if anyone in the Calgary area, I think is looking for these types of supports or wants more information, they can reach you guys there.
Yes, absolutely. Yeah.
Wonderful. So Cheryl, it was so nice talking with you for this first episode. I feel like slightly emotional about the pandemic and also very just like, my heart feels warm about all of the amazing work that you did to make sure that the people who go to the Alex had the proper support and care throughout the pandemic. And not only that, but like throughout their regular day-to-day lives. The community health centers are extremely important, and you're one story of hopefully many that I will get to explore. But I'm really happy I get to start out with you and meet you today.
Thanks so much, Hillary. I feel honored to be here. Thank you.
Thank you.
Thanks
Bye.
for letting us share our successes and the challenges that we faced during this pandemic. So,
of course. And I hope for only continued successes, and that you guys continue to share this beautiful story with other people. It's a really encapsulated the importance of the CHC model. Thank you.
Thank you.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.